I've been using the Art Essential products for quite some time. It's almost been now 2 years. They've been very helpful in my laparoscopic cases. For this particular patient, she had uterine fibroids, large uterus, and it was going to have a minimally invasive hysterectomy. So for this particular patient, we really wanted to use the Art Essential devices primarily for suturing the vaginal cuff to be certain that we had good approximation of tissues in an efficient manner. We're able to reconstruct the pelvic anatomy with the uterosacral and cardinal ligaments. So we set up the 3D system with Karl Storz, did our hysterectomy in pretty much a standard fashion. And then when we got down to the vaginal cuff, that's really when everything with this particular patient was great. The 3D allowed us to see the tissues very well. I mean, the images were fantastic. The patient had had 2 previous cesarean deliveries. We were able to dissect the bladder from the uterus and cervix well, utilizing the 3D technology. And then when it came to suturing the cuff, it really made a big difference in utilizing our Art Essential devices. They've been very helpful in efficient suturing of the vaginal cuff, reconstructing the pelvic anatomy. It's really cut down my operative time in doing that. The 3D added visualization, but it also added ease. It was much easier to grab and do our needle exchanges with the 3D technology, being able to have that depth perception and vision. And I think that really speeded our closure of the cuff and accuracy of the cuff. Even my physician's assistant that was helping me that day was like, "Wow, this was just so much easier and quicker than the 2D version." I mean, we looked at each other and were like just amazed. The 3D technology really allowed my assistant excellent depth perception, grasping the tissue more easily and more efficiently. It was like one grab rather than 2 or 3 to make sure I have it positioned right, because they could see so much better and had that depth perception. And then for myself, the same thing. The needle placements and things were much more accurate. You didn't have to sort of rethink, is this the right angle or not? It was much more fluid and simple to do. And then the needle exchanges, regrasping the needle, positioning the needle properly in the needle holder, were again also much more easily done and more efficiently done. So rather than doing 1 or 2 movements, it was one movement, one movement, one movement. It really sped up the procedure. Yeah, it does, because the shorter the procedure is, again, short, you have to do what's safe for the patient, what's right for the patient, and take your time and do the right things. But having said that, yeah, the more time you can save in the procedure, you're saving this patient from additional anesthesia time. That's going to translate to quicker recovery. I mean, we do a lot right now with enhanced recovery after surgery, different medications for anesthesia, trying to limit narcotics during their anesthetic process. I mean, it's a whole field that has come up that's allowing us to send many patients, whether it's RGYN patients or orthopedic patients or others, home the same day, rather than prolonged stays in hospitals and things, related to sometimes just recovering from anesthesia. So yeah, the less time a patient spends asleep, quote unquote, the better. Yeah, definitely. I mean, as we talked about earlier, the grasping of the tissue, the grasping of the needles, the grasping of the suture material, all of that is much more precise and direct. It's one grab and I have it, rather than kind of having to adjust a little bit because you don't have that 3D vision. Because you're working, in a 3D environment, but you're looking at a 2D picture. Now you're looking at a 3D picture as well. So it gives you a lot more depth perception and makes things easier and efficient because of that. I did another case a week later, which was actually a V-Notes procedure utilizing the 3D camera. Same type of thing. With V-Notes, you're looking at a much smaller space from a different angle than you might be used to in conventional laparoscopic surgery. Again, it gave you that depth perception to be able to identify a blood vessel going this way and then the bowel behind it, and you felt much more comfortable because you said, oh, 2D, I'm not sure how far am I away from the bowel when I'm doing this blood vessel or not. With the 3D, it gave you a much better feeling of depth, and you could say, yes, I'm safe. And you didn't have to kind of look 3 times to make sure you're safe. You kind of knew that you were. Number one, I've been utilizing the Art Essential suturing needle holder for quite some time now. And I do a lot of cases. I do, not unusually, sometimes 2-3 hysterectomies a week. I see all those patients personally in the office when they come back, and, you get to critique yourself a little bit. And when you look at how the vaginal cuff has healed, how well you've done, suspension of that cuff, being able to incorporate the uterosacral cardinal ligament complexes, suspend the cuff well, suture it well. You're not getting granulation tissue. You're not getting, a cuff that isn't well suspended. It looks very anatomically correct. It heals well. Patients have very little bleeding afterwards. So the more precise you can be in your suturing and the better a job you do suturing that cuff, I think the better the patient heals. I've definitely found that with the Art Essential instrument and my ability to suture well with that. Taking the next step with the 3D is definitely beneficial because it makes you not only do a really nice job and do well at it, but it makes you more efficient at it and even more precise. The instrument is easy to use. You have to kind of realize how your wrist movements go. They're different than with a conventional straight stick needle holder, for example. And you have to learn how to use the instrument well, get everything out of it that it can give you. So it takes a while to kind of train your brain. So I did quite a bit of work in the lab with the instrument before I did my first case, just so I could realize how the instrument moves and how that's different. So the hand-eye coordination there is something that you have to adjust to. So a little bit of homework in the lab is a very good thing to do. So that was kind of my first thing. Let me try it not on the patient. And then once I started working with patients and utilizing the instruments in actual surgery, I realized you could lock the instrument and then kind of use it in a hybrid fashion. You could get the advantage of, let me get my angle for my needle properly, and then I'll lock the instrument and then kind of drive the needle the way I'm used to. And then as you got better and better at doing it, all of a sudden you found yourself, oh, I'm not even locking the instrument anymore. I'm just letting it flow and it's just moving easily. So time and practice is important for these instruments. Well, I think a series of particular cases is probably still beneficial, but I think the 3D does make it easier to utilize the instrument. As I said, what we found very quickly was that grasping the needle, positioning the needle, moving the needle is much easier with the 3D. It's one movement down to the needle and I grasp it, rather than sort of one movement and I'm not 100% sure because I don't have the depth perception. So yeah, the 3D will make these instruments much, much easier to use. Definitely as a equivalent, if not better, yeah, I would say the answer to that is yes. The advantage here is that in many hospitals, and definitely speaking of ours, robots are only available at certain times. So at 2 in the morning or on a weekend, I don't have the ability to even use a robot if I wanted to. Do I then move that case that may need to be done at 2 in the morning and wait till the robot is available on Monday? The answer to that is no. I'd really rather not do that. And you can't sometimes do that. Here, you have the ability of, depending upon how the setup is in the hospital, either have the 3D available in one particular room, or be able to move the 3D equipment from one room to another. So that gives me huge flexibility. And then I can add my Art Essential instruments to it if I have a complicated case where I find the articulation and extra manipulation and ease of use of these instruments would help me. So I can pretty much use this combination 24/7 and not be limited by needing a robot team or a robot room or someone that knows how to run those instruments. It gives me tremendous flexibility.